Good morning. Thank you, Chairman Ferguson, John Schweppe, Brandon Showalter. Thank you also to Jackie, Simon, Maria, Laura, Prisha, Kayla, Beth, and Forrest for sharing your medical documents with me. And actually the books that are out there, my Lost in Translation, that's thanks to Do No Harm. So thank you very much, Do No Harm. Section 5 of the FTC Act says, as you heard, that fraud and deceptive practice means representing as facts things that are entirely unproven or demonstrably false, thereby misleading the consumer in a material way. When I examine gender-affirming care and the history that led up to it, I see fraud and deceptive practice everywhere. Going back decades, I see it in the landmark experiment on Bruce Reimer when he was a toddler and John Money instructed his parents to socially and medically transition him. This was to be Dr. Money's proof for a concept he'd come up with in 1966 called gender identity. Dr. Money announced to the world that the experiment was a resounding success, and for years the world believed it. But in fact, it was a catastrophe from the start. Decades after Dr. Money, consumers were misled again when gender specialists took the results of one tiny Dutch study whose subjects were carefully chosen and led parents to believe that every child distressed about their sex could benefit from that model of care. And now, families are told there's a consensus among clinicians about the best way to help these children. But there is no consensus. What there is the silencing of opposition. There are many more examples that you're going to hear about today, but I think it's fair to say that the fraud is wide and it's deep. I decided to focus on 3 topics: deceptive practice in language, in medical records, and in therapist letters for support of hormones and surgeries. But first, before discussing fraud and deception, I'll remind you of what's true. Humanity is divided into 2 biological categories. Male and female are established at conception. While there are many ways of being male or female, sex does not change and cannot be changed. These are universally acknowledged facts, but gender-affirming care is based on their denial. The premises of gender-affirming care are: every person knows best who they are, regardless of their age, development, or mental health. All gender identities should be rubber-stamped by parents, doctors, therapists, and teachers. Medical interventions, including the removal of healthy organs, must be available on demand. Gender-affirming care's denial of biological facts is right in front of us. We don't need to make any FOIA requests to see it. All we need to do is examine the language. Look how aggressively the proponents of gender-affirming care compel the language of doctors. This is from a course given by a Dr. Erica Metz, Medical Director of Transgender Health for Kaiser Permanente in San Francisco. In this course, doctors learn that there are acceptable and unacceptable terms. For example, sex change operation is not acceptable. Doctors must say gender-affirming surgery. Born male is unacceptable. The proper term is assigned male at birth. Here's another slide from the same course. Always use the pronouns the patient asks you to use, regardless of what they look like to you or what their name is. And the red highlight, I didn't do that. That was from the original. Why is it so critical to Kaiser to control their doctor's speech? Well, they know what George Orwell taught us. Language is an instrument. It can be shaped for a particular purpose. It can change the way we think. I'm going to go through some of the vocabulary of gender-affirming care and demonstrate how this language is designed to change the way that we think about male and female, and to mislead consumers in a material way. So basically what I'm suggesting today is that all these terms are Section 5 violations. Gender identity. We are told that whether we know it or not, we all have an inner sense of being male, female, both, or neither. And that's represented by the brain in this slide, which, by the way, comes from a sex education course. And we're told that that sense not only is untethered to material reality, but it overrides it, which is the body there. The brain overrides the body. You can have, for example, a girl's brain in a boy's body, and that boy is actually a type of girl, a trans girl. This belief is a cornerstone of gender-affirming care. It's represented as factual. It's not up for discussion. Now, science studies the material world, the world that can be directly observed, measured, and verified. The proponents of gender-affirming care declare that a person's inner sense, something that cannot be directly observed, measured, or verified, is more authentic than the material world. Now, what would you call that? Is that a philosophy? Is that a religion? I'm not sure. But I am sure that the idea is entirely unproven and unprovable, in the same way that we can't prove the existence of a soul, even though we might believe in one. There is no objective evidence of being born in the wrong body, and saying so misleads and takes advantage of consumers, and it impacts their medical decisions. I know from my patients and many others that when young people hear the idea that their feelings are more consequential than their bodies, and when they hear this idea endorsed with great certainty by therapists and doctors, echoed by professional organizations and government agencies, they believe it. They believe that this is bona fide science, and that they have a medical condition whose only cure is pharmaceuticals and surgeries. Here's Dr. Gallagher, our favorite Miami surgeon. Girls see the language on her website, female to male procedures, and they genuinely believe that Dr. Gallagher can turn them into boys. And here's Johns Hopkins telling boys they can get female genitals. Boys see this, and they think they can get an actual vagina and be a woman just like any other. But Johns Hopkins and Dr. Gallagher cannot do these things. Their claims are demonstrably false. They deceive and exploit vulnerable and misinformed consumers and their families. Preferred pronouns. If you can pick your pronouns, it means that your feelings determine who you are. And it means, again, that biology is inconsequential. Preferred pronouns are part of social transitioning, and we know that social transitioning increases the odds that gender dysphoria will persist. Nevertheless, the captured American Association of Child and Adolescent Psychiatry instructs parents, use the name and pronouns your child prefers. Chicago Children's Hospital have pronoun stickers for staff. And the pressure is intense, trust me. I've talked to a lot of people working in hospitals. The pressure is very intense for staff to wear these pronoun stickers. In my opinion, using opposite sex pronouns endorses something that can never be. It supports a patient's false belief, and it impacts their medical decisions. So that's fraud right there. Sex assigned at birth. The purpose of that phrase is to lead people to think that male and female are a random designation, a doctor's whim. This is utterly false. I don't have time to discuss intersex. You're going to be hearing about it later. But the sex assigned at birth term, which we hear 24/7 everywhere, is designed to change the way that we think about male and female. Instead of it being a inherent quality of every one of the billions of cells in our body. Cisgender and non-binary. The word cisgender was invented in 1994 by a graduate student at the University of Minnesota. The inventor explained, there did not seem to be a way to describe people who were not transgender without inescapably couching them in normalcy and making transgender identity automatically the other. This student was unhappy, in other words, about how the transgender identity was perceived. And the goal of creating the word cisgender was to change that perception. So again, the goal was to change how we think. We are given the impression that cisgender is a scientific classification of people, but it's not. Non-binary. We are told this is a valid identity for people who are both male and female, neither male and female, or some other combination of male and female. Kaiser Permanente provides this menu of non-binary options. We might think this is silly, and it is, but to vulnerable youth, it means that they can have a new identity every day of the month. If identity is based on feelings and you feel different from day to day, then why not? Do you see why so many young people are confused? I once had a 15-year-old patient who identified as non-binary. I asked him to explain what that meant. He thought for a moment, and he gave me, hands down, the best definition of non-binary I have ever heard. Excuse the language. I would never speak this way, but it's refreshing to hear the truth. Moving on. Wrong puberty. That's a disturbing one. Puberty is not a disease. You're going to hear more about that from Dr. Cretella. Using that phrase is profoundly misleading, as if someone can go through the wrong puberty. Top and bottom surgery. These are dangerous euphemisms. They're meant to distract you from what they really are. The removal of healthy organs causing disfigurement and a laundry list of serious medical problems, as you've just heard. And you'll hear more about that from Dr. Lappert. Justice Thomas called top and bottom surgery sanitizing language, and he got that right. Genital reconstruction. Nope. Reconstruction means that that particular genitals were once there. That's demonstrably false. A surgical procedure that creates a faux vagina is not reconstruction, it's construction. Same with hormone replacement therapy. You're not replacing anything. It's not the same as giving estrogen to a postmenopausal woman, and it misleads the consumer. And finally, chest feed. The CDC, until recently, because their site was scrubbed, and this page is no longer there, it endorsed the idea that men can lactate. Well, the female body is designed to lactate, the male body is not. Men do not lactate unless they have a medical disorder or they're pumped full of drugs that cause a nipple discharge. This is altogether different from the natural process of lactation that occurs in women. The term chest feed, aside from erasing women in a most offensive way and dehumanizing all of us, misleads boys and men. To summarize, the language of gender-affirming care seeks to deny the primacy of biology in determining male and female. It advances the notion that feelings override the objective reality of our sexed bodies. Such beliefs can harm patients and are not consistent with science in the 21st century. Now, fraudulent language in medical records. I'm going to tell you about this case that was reported in the New England Journal of Medicine. I'm not giving you all the details. This is a very concise review. And this article in the New England Journal called this woman a man and he, him pronouns, so I'm going to go ahead and do that, even though I normally wouldn't. 32-year-old Sam came to the emergency room. He had intermittent lower abdominal pain and high blood pressure. He told the triage nurse that he was a transgender man. His electronic medical record indicated he was male. The nurse noted that Sam was an obese man and he was comfortable between his bouts of pain. She assessed his condition as non-urgent. Lab tests were ordered, including a pregnancy test. It took several hours for Sam to finally be seen by a physician who took a detailed history, reviewed his lab results, and did a physical exam. He determined that Sam was in labor and had preeclampsia, which is an emergency that can be fatal for mother and child. A heartbeat could not be found on the ultrasound, and soon thereafter, Sam delivered a stillborn baby. Though he had obviously not planned or expected the pregnancy, he was heartbroken, and the loss of his baby produced a major depressive episode. The language of medical records must be accurate. There was once a standard way to indicate a patient's sex in medical records, but no longer. And I want to give a shout out to Dr. Carrie Mendoza for pioneering the work on safety in electronic health records and writing a model policy. With her help, Texas passed legislation requiring not gender identity, not legal sex, but actually just sex, male or female, on medical records. So why is it so critical to accurately indicate a patient's sex on medical records? Well, we can see from Sam's story, of course, what happened, but there's much more. The X and Y chromosome have a deep and lifelong impact on each organ system. In fact, on each cell. There are significant differences between male and female in health and disease, and there are thousands of examples of this. For example, women are more likely to develop certain heart arrhythmias. 80% of autoimmune diseases are in women. Certain drugs are more powerful in one sex than in the other. So it's potentially life-saving to have the correct sex identified on medical records, not gender identity and not legal sex, because that can be changed. But here's what's going on. And this is from NYU Langone Hospital. In 2018, this child was identified as a female, but 2 years later, this same child was identified as a male. At the Oregon Health and Science University, this is a surgeon's entry for a man, Forrest, who you're soon going to meet, who came in for breast implants, and it says the sex is female. And even more, well, equally incredible is that this surgeon's note, for purposes of insurance coverage, stated that this is a woman with underdeveloped breasts, with who needed a more feminine shape to her breasts in order to help with her gender dysphoria. And if you, again, this is for the insurance companies to cover the cost of the prosthetic breast insertions. And if someone wasn't careful in reviewing these records, they would have thought that this is a young woman who simply has underdeveloped breasts. This is back to Kaiser again, Kaiser Permanente in California. This was an admission note for Layla Jane, who you just met. She came in for her bilateral mastectomy, and it's indicated here that she is a 13-year-old male. Now, more from Kaiser Permanente. This patient is identified as non-binary, a non-binary patient. Now, this is not someone's Facebook page. This is not Instagram. This is a legal document identifying a person as non-binary. Boston Children's has something interesting, and this was given to me by Simon. You'll note it says legal sex up there on the top right, but that means that someone whose legal sex had been changed to a different sex, it would just say that up there. And then, okay, they have something very interesting there. They have Boston Children. They have an organ inventory. An organ inventory. Now, what's that? You see a list of organs, okay? Breast, cervix, ovaries, penis, testes. And what's supposed to happen here, I guess, is that, I don't know if they were indicating that Simon had all these organs, or whether someone forgot to make a check mark next to the ones that he actually has. This is not medical care. This is dehumanizing. I mean, that's a judgment call, I guess. But as a doctor, okay, this is not medical care. Now, returning to Forrest, his records didn't say anywhere, it didn't indicate that he had gender dysphoria. Oh, I said that already. That the surgeon wrote that he suffers from feminine breast shape. I already did that. Now, I want to move on to the next thing. And this is the diagnosis, endocrine disorder, not otherwise specified. And this is an example of a lab request for estrogen that was written by a Dr. Grace Evans, MD, in, where is this? North Carolina, right? South Carolina? North Carolina. Now, this is a male patient who's on estrogen, and the doctor, for probably insurance purposes, has indicated diagnosis E34.9. The lawyers in this room, take note, E34.9. I want to explain that to you. It means endocrine disorder not otherwise specified. Oh, here's another example, sorry, Dartmouth College Health Service. Also, you see below that, endocrine disorder unspecified. And this is another one for feminizing HRT. What is diagnosis code E34.9? In the International Classification of Diseases, they have thousands of diagnoses. And so they've categorized all the these are medical diagnoses. The endocrine diagnoses are between E00 and E89. These are endocrine, nutritional, and metabolic diseases. So for example, there's hyperthyroidism, type 1 diabetes, polycystic ovaries. These are all medical diagnoses that are between E00 and E89. These are endocrine, nutritional, and metabolic diseases. So for example, there's hyperthyroidism, type 1 diabetes, polycystic ovaries. These are all medical diagnoses that are between E00 and E89. These are all medical diagnoses that are between E00 E00 and E89. But then you have E34.9, endocrine disorder unspecified. What is that? It says that this is an acceptable diagnosis when clinical information is unknown or not available for a particular condition. Okay, it's preferable to use a more specific code, but you can use that code when they accurately reflect what is known about a patient's condition. Now, all these people here, these medical records that I showed you, and I'll show you some more, these are physically healthy people. They have no medical diagnosis whatsoever. They have a psychiatric diagnosis. But this E34.9 is being used in a fraudulent way, I would say, in order to get payment for the services. Now, this is what Planned Parenthood of Southeast Pennsylvania says. In order to meet the needs of most insurance companies and patients, we typically use the code E34.9. We recognize that much of the language around billing for gender-affirming care is troublesome. What they mean by that is that it's called a disorder. When you say endocrine disorder, they're objecting to the word disorder. We recognize this is medically necessary care and will work to decrease barriers to get folks the care they need. So they're explaining why they use that diagnosis. So what I'm going to do now is go into the fraudulent notes that are written for individuals who need letters from therapists in order to get their cross-gender hormones, opposite-sex hormones, or surgeries, and how these letters are fraudulent. So this is actually Prisha's note. You're going to meet her soon. On the first day that she saw this therapist, the therapist indicated that she had a major depressive disorder, recurrent, moderate. That is a serious psychiatric condition. It is a condition that impairs one's functioning and day-to-day life. And she also indicated that Prisha had an eating disorder, doesn't go more than 2 days without eating. That's a serious eating disorder if she sometimes goes 2 days and doesn't eat. Yet on the same day that this therapist indicated this in her chart, she wrote a letter for testosterone saying there is an absence of problems related to mood. She just, what? She just wrote the same day she has a major depression and eating disorder. Yeah, like Simon's father right here, he's going like, yeah, like what? How can you do that? And she writes later on in the second paragraph, there's no evidence of psychopathology. What? And the diagnosis, gender dysphoria, anorexia in remission, nothing about the depression, nothing about having not that long ago had serious self-injury and cutting, and a whole host of other mental illness diagnoses. So she writes for the testosterone the same day, day one. This is another therapist's letter for Prisha to the surgeon, and this therapist wrote, he presents with no apparent residual psychiatric symptoms and is quite stable. Oh, no, wait, this is Laura Becker's. Okay, I'm sorry. This is Laura Becker's, the letter that her therapist wrote to the surgeon. And Laura had been hospitalized for suicidality just 2 months before this letter to the surgeon for her bilateral mastectomy. 2 months. You cannot say that someone that's just 2 months out of a serious psychiatric hospitalization has no residual psychiatric symptoms and is quite stable. It's misleading. It's misleading to the surgeon. And she also wrote that, that Laura demonstrated excellent insight into transition. Well, Laura was under the impression at that time that this is the only thing that would cure her symptoms. This was the only thing that would prevent her from committing suicide. That is not excellent insight. That is not informed consent. So these letters omit critical information about the patient's mental health, information that impacts their ability to provide informed consent, and information that one would hope might make the surgeon think twice before using the scalpel. So to wrap it up, here's what Admiral Levine said about gender-affirming care. Whoops. Oh, I messed up the letters. Well, you know what? They're all the same. They're all the same in the same bad way. So Admiral Levine said, gender medicine is a medical field like any other. It's all very carefully done. No, Admiral Levine, I don't think so. I don't think it's done carefully at all. I think this W-Path doctor put it more accurately. Dr. Marshall Dahl at a W-Path meeting. No audio? No audio. Okay, I'll talk for him. He said, not only are the medications off-label, the whole field is off-label, right? But that's all good. Well, I'm here to say, all of us are here to say that that's not good. It's not good at all. No more misleading the consumer. No more representing facts, things that are entirely unproven or demonstrably false. Families deserve much better, and today is a great start. Thank you for listening.